The Autism Research Institute relies on the generosity of donors like you to make this webcast possible. If you enjoy this presentation, please consider making a donation. Thank you.
Before we get started, I'd like to introduce our speaker. Vicki Koblener is a registered dietitian and nutritionist with many years of experience in applying a functional approach to nutrition. Vicki has extensive experience using gluten-free, dairy-free, low allergen, GFCF, SCD, GAPS, FODMAPs, and other appropriate diets to reduce inflammation and promote healthy digestive function. Vicki has worked with schools to develop a whole foods approach to student meal planning. She lectures frequently, both locally and nationally, on topics such as autism, special diets for food allergies and intolerances, healthy pregnancy planning, and choosing appropriate nutritional supplementation. These webinars are made possible thanks to generous donor support, including a grant from Local 25 Boston Teamsters. So this is a follow-up on a talk that you gave last February. So anyone who missed that can go back and watch that in our archives. One of the first questions that we had was about constipation and mood, and whether or not it's really just the discomfort of constipation or if it's something about the biological issues that happen related to that.
Cool. So all of the above. Constipation can definitely affect mood, and it is partly just the discomfort. That's, clearly all of us, when we can't go to the bathroom, get irritable and feel uncomfortable. So that's definitely a part of it. But I think, whenever we talk about autism and we talk about underlying causes and we try to think about functional approaches to how the whole body is affected, one of the things we know is that gut dysfunction is a primary and very, very prevalent problem with kids on the spectrum. And in that regard, number one, chronic constipation is a sign of some sort of gut dysfunction. Gut dysfunction is also something that we know can impact mood. So the first thing you want to think about is, well, what is the primary cause of the gut dysfunction, and how can we ameliorate that? So for example, something like magnesium is terrific at helping to move the bowels more successfully, and that may be something that we need to help the constipation. But the other piece about it is that there's a lot of research that shows that depression, anxiety, other mood issues are inflammatory in nature. They are results of an inflammatory condition. So with constipation, what you tend to do as the stool sits in the gut, you then reabsorb some of the toxins that it's trying to carry out of the body. So if your body is then reabsorbing those toxins, then you're going to be more inflamed, more irritated, and you're going to have a greater amount of stress on your body in general. So it's the physical discomfort, it's the very likely gut dysfunction that needs to be addressed, as well as the onset, the absorption of other toxins that we really want to get rid of, that can all be linked to the changes in mood. So getting that gut healed is a primary focus there.
I've got a question here about keratosis pilaris and rashes. So that's not really a mood question, but they were asking about how that connects to all these issues with constipation, but also just in general about approaches that people can use for that and what that might indicate.
Right. So actually, so interesting. Keratosis pilaris in and of itself would not necessarily tell me that somebody has a mood issue, but keratosis pilaris is linked to lack of omega-3 fatty acids. And we know that omega-3 fatty acids are really important for normal mood and normal cognition. So again, very often it's those physical links, whether it's constipation, whether it's rash, and again, additional rashes above and beyond keratosis pilaris are often indicators of gut dysfunction. Again, if you've got eczema, if you've got rashes, very often the skin is an excretory organ. It's trying to get rid of something. And when we see those rashes coming out, we know the body is trying to get rid of something that should not be there. So if I saw somebody with keratosis pilaris, the first thing I'm going to do is definitely recommend an increase in omega-3s. We want to lubricate that skin. We want to lubricate the brain cells. Remember, the brain is predominantly fat, and we need those good, healthy fats to help keep the brain functioning properly. So while we might not think those two things are directly linked, yes, you see keratosis pilaris, you want to think about adding more omega-3 fatty acids. You may also at times want to think about vitamin A, but that's something you should be doing with the help of a practitioner, because vitamin A is a fat-soluble vitamin that gets stored, so you can get too high a dose if you don't know what you're doing. So, but things like vitamin A, things like omega-3s are terrific for helping the keratosis and can also help the mood.
All right, so another question, somebody was asking about hydration. We know it can affect digestion. Does getting enough water have a big effect on how you're feeling mood-wise?
It can. It's not one of the things we think about as one of the most important, but again, think about the fact that all your cells have fluid in them, and the body is predominantly fluid. Fluid is necessary in the cells to help us detoxify. You know, again, when we urinate, we're detoxifying as well. We need, and even inside the cells, we need that fluid to help us detoxify and to help keep those pathways going, all these different biochemical pathways. When you feel dry, when you're dehydrated, when you have low hydration, even if it's not frank dehydration, you are going to feel more fatigued. You're going to feel more irritable. So yes, it can impact your mood. So good hydration is important. And again, I always go back to detox because that's one of the things our kids need so much of, whether it's constipation, whether it's lack of hydration. And those two things are very much linked. So if you've got a kid with constipation, you want to think about how well hydrated they are and help them with that hydration. But again, getting the body to pee and to poop and to sweat are all ways that you're going to detoxify, and all of those things are going to help with mood.
Okay, great. It looks like you're getting a lot of questions online now. There are quite a few there if you want to peer through those.
Sure. Okay, so Sandy wrote in, why is it recommended to avoid soy, and is organic soy okay? So there's a lot of different opinions about soy, and even if you speak to different practitioners who do this work, they may not always have the exact same opinion. But the things we know about soy is that, number one, it can be very cross-reactive with dairy. So if you've got a child who has a sensitivity to dairy, you want to be careful with soy. Most of the time, what we see, and we've learned to, educate our clients about this, is you tell them you need to go on a dairy-free diet, they'll start using soy milk and soy ice cream and soy cheese and, soy cream cheese. And again, what you're doing now is you've got this potential cross-reactivity, and you may not be seeing the benefits. So that's the first thing. We don't want those who are sensitive to dairy to be sensitive to soy and us not see the benefits of that change in diet. In addition to which, most soy is genetically modified. We don't recommend genetically modified foods, so that rules out the majority of soy. Organic soy is better. If I start somebody on a dairy and gluten-free diet, I'm also going to recommend that they are soy-free. After that, I'm not averse to trying to add some soy in, and in that case, I would add organic soy as opposed to something that could potentially be genetically modified. And the other piece of that, though, is that I also look at, in keeping with everything else we say about a whole foods diet, you really want that soy to be whole, so something like an edamame, as opposed to like a soy protein isolate, which is a processed, again, unnatural way of making the soy. So we try to avoid processing in general. So my recommendation is generally do a gluten, dairy, and soy-free diet. If you're doing well with that, you can try to add in some soy. But if so, make it whole, a whole type of soy, and make it organic. And the other thing is we do find a lot of people do tolerate soy lecithin and soy oil in small quantities, even when they're dairy-free. Again, in the beginning, we like it to be completely soy-free, but those things are found in so many products, it's sometimes harder to avoid them. And very often, we find people do okay, even when they consume that small amount of soy. So that's that answer. We have another question from Anita. For those with ASD who suffer from low mood, depression, is there a recommended diet? Would love to hear the overall presentation on the topic. Thanks. So I would refer you, Anita, back to the webinar that I did in February, which is expressly focused on nutrition and mood in ASD. But some of the things, in brief, some of the things we can take away from that lecture are inflammation is very, very intimately involved and implicated in mood disorders. So whether that inflammation comes from not enough antioxidants because the diet is too high in processed food and not high enough in things like fruits and vegetables that are rich in antioxidants, that's one piece of it. Sugar is pro-inflammatory. So any diet that's high in sugar. So again, we see the relationship between processed foods, lots of white foods, carbohydrates that have no nutritional value, that again will elevate that inflammatory process. Carbohydrates and sugars are biochemically in the same structure. So we want to reduce sugar, we want to reduce carbohydrates. I don't tend to reduce fruit because fruit is rich in fiber and fruit is very rich in lots of other good nutrients, especially antioxidants and phytonutrients that are anti-inflammatory. So while I don't like to overdo the fruit, I don't throw that into the same category as the other sugars and the more starchy processed foods. So those are things I take out. But we also know that the quality of what we eat in terms of how the animal was raised or how the plant was grown. So reducing things like pesticides. Pesticides are linked to mood changes. We also know that healthy animals provide us with better amounts of certain nutrients, even things like omega-3s, which are linked to better mood. So getting the diet to be as rich in whole foods, unprocessed foods, and very, very plant-based in terms of vegetables and fruits is really your goal. And then reducing as much as possible foods that come in packages, boxes, cans, etc. And making sure it is very rich in brightly colored vegetables and fruits, and also rich in good healthy oils like nut oils and avocado and olive and omega-3s. Those are the things that are super important. Another piece of diet for low mood and depression is focusing on vitamin D. So in terms of vitamin D, right now for many of us, I don't know where everybody's from, but for, the US population, we're in the summer right now, which is great. You can go outside and you can make a ton of vitamin D from unprotected sun exposure. And nobody should burn, but 15 or 20 minutes of unprotected, sun-blocked exposure can make a lot of vitamin D in the body, much more than you will get from a supplement. During the winter months, you definitely need to, most people need to supplement vitamin D. And what we see is that in the serotonin pathway, serotonin is one of our neurotransmitters that modulates mood, and it's related to happy mood, up mood. Serotonin is completely dependent on a variety of things, one of which is tryptophan, which is an amino acid. That means that you need enough protein in your diet in order to make serotonin. But once that tryptophan crosses the blood-brain barrier, two of the things it needs very specifically to manufacture serotonin and make it active are vitamin D and omega-3 fatty acids. So if either of those things are inadequate in our bodies, we're not going to be able to produce that serotonin as well as we would like. So it really, I always say, this is my big standard comment is, you can take as much Zoloft, you can take as much Prozac as you want, but if you don't have enough vitamin D or omega-3s or zinc or magnesium or all these other things to make serotonin, it's not going to help. So again, looking at gut health, getting you, number one, to reduce that inflammation, but number two, making sure the gut is able to absorb the nutrients from the food is primary. It's very key. Making sure the diet is rich and nutrient dense so that we can have access to those nutrients that we need are two of the key pieces of regulating mood. So high in fruits and vegetables, good quality animal protein, high in good quality fats, low in processed foods, and gut healthy. All of those things are going to be very important.
This one's from Jenny. She says her son is diagnosed with autism. He has pretty good digestion and has no issues with bowel movements. She's just wondering about quantities of fruit and what fruit is best. And then also, what about rice and potatoes?
Okay, so Clearly, I can only give you general recommendations because I don't know your child individually. And even what we know is that even kids who don't have frank gut dysfunction, the ones who don't have chronic diarrhea or constipation or chronic abdominal bloating or belly pain, very often they still have a dysfunction in their gut. So you still want to explore that option. I have a client that we worked with recently who has been down the road with many different practitioners and done lots of things. And she always said, I don't really think it's a gut issue. It's not a gut issue. And we ended up saying, let's just give it a try. Let's treat the gut anyway. Let's see how it goes. And we saw tremendous improvement. So even though it wasn't a child who was, that it was apparent that it was a gut issue, when we actually tried to help with it, it did make a very big difference. So I don't like to rule that out. But even in the absence of a gut issue, you want to make sure that the diet is still anti-inflammatory and pro-phytonutrients that are going to help reduce inflammation. And that, again, includes lots and lots of vegetables, some fruits, and limitations on the amount of carbohydrates you eat. So it's not only for gut health, but it's also just for the whole inflammation/oxidation profile. I don't limit fruit too much, but again, depending on the child, if it seems like it's something they're craving excessively, I'm always cautious. Because remember, it doesn't have to be a gut problem. It can be a phenol problem. It can be a histamine problem. There can be many other reasons why somebody doesn't tolerate a particular fruit or vegetable. In terms of fruits and vegetables, the ones I generally like best is starting with things like berries, which are really, really rich in antioxidants and tend to be lower in terms of responsiveness. So that's one of my favorites. And avocados, of course, if we're considering that a fruit, we throw that in there. But I know most people, when they think of fruit, are thinking of the sweet ones. But berries are a great place to start. And in terms of rice, corn, things like potatoes, again, if there's no frank problem with them, I'm not averse to them. But you want to limit how much. You want to keep it to about one serving. And again, by a serving, you want to look on a package or a half a potato is actually a serving. You want to look at what's a serving of that starchy food, and I try to limit it to about one per meal. So another question I have is, I have a 19-year-old that will only eat carbs and has started having blind rages about 6 months ago. I know that I need to clean up his diet, but I can't while he's raging. Is there anything that can stabilize the carb cravings so I can manage the changes in his diet? So, yeah, that's a big challenge. It's certainly one I've seen before. It does make sense. So a number of things. Some of it is mixing foods. So again, some of this may be obvious to you, but if he really likes mashed potatoes, and I would do that kind of starting with some, riced cauliflower, doing a mix of cauliflower and potato, or half rice and half cauliflower rice, or even 2/3, 1/3, whatever you can manage. Starting to replace some of the things that he's very focused on by just changing the balance. The other thing I often find is if we can increase other things, we can change the balance. So even if he wants to have his carbs, I would look at, can you do a muffin that's made with nut flour? And it could be, again, half grain flour and half nut flour, but if you can at least remove some of it, you're moving forward. Whether it's a pancake or a muffin or a waffle, if you're trying to use some nut flour to replace the existing carbohydrate-laden flour, then you're changing the balance. Can you give him other things outside of it, especially beverages? So if there's any kind of shake or smoothie that he would drink before he ate his breakfast or his lunch and would kind of satiate him, but didn't have, that had some protein powder in it and had some vegetables in it, and then let him get some of that to fill up his gut a little bit before he eats his carbs. The other thing is behaviorally, and I know with the rages it's hard, but some people do try to do kind of a one bite. So give him his carbs, show him his carbs, but he takes one bite of carb and then he takes a bite of something else, if he's willing to do that. The other thing is figuring out how to help those rages. So things like binders can often help rages. Binders are things like activated charcoal or GI detox. if you can help to limit the rages by using a binder, that's another, that is not a nutritional intervention, but it's one, if you can stabilize the rages, then you can, you know, work more on the diet. So those are some of the things that I would try to do, is small changes in what he's currently eating, small substitutions to change that balance, and then also try to help stop the rages with something like a binder, or even some kind of, you know, again, I don't know him, so I can't tell you specifics, but, you know, looking at the adrenal system, looking at whether there's some sort of infection or inflammation that's causing the rages. Those are all the things that you're going to want to look at to see how you can affect that.
This is from Denise. She's actually in Canada, and she's asking about, her son is 18 now, but when he was 15, he started having tonic-clonic seizures. And he's in medical care, so I know you can't give any kind of advice about pharmaceutical support, but she's just asking about, is there a connection, or are there things that parents or nutritionists have done to help support seizure patients nutritionally? So asking specifically, she said he's got a lot of sensory issues too with food, so it's been kind of an ongoing battle for them. She's just wondering about any kind of research or recommendations that nutritionists have about seizure patients.
Yes. Oh, absolutely. So for seizures and seizure activity, one of the things that we know has been very helpful, and I don't know if you are aware of it, but the ketogenic diet has been tremendously helpful for children and adults with seizures. So that's one thing that I would consider. Now, a ketogenic diet is a very complex diet. It's one that needs to be monitored medically because it is not nutritionally adequate. So, and it involves, if you're not familiar with a ketogenic diet, it essentially removes almost all carbohydrates from the diet. It's a predominantly fat and protein diet. It's a very fat-heavy diet with a fair amount of protein, a smaller amount of carbohydrates. And there has to be very, very specific balances of how many grams of fat to protein carb that you consume. So it's not something that you do off the cuff. It's something that you really have to weigh and measure all the food. So it is a complex diet. Now, that's one that's generally managed with a medical practitioner involved. And I would highly, highly only recommend that somebody does that way. But something like the specific carbohydrate diet is a different, it's not a seizure-focused diet, but it's another one that is predominantly protein, fat, and vegetable-based. And we have seen many of our clients do well when they move to the specific carbohydrate diet because the carbohydrate levels are reduced substantially. And that can be very, very helpful without going fully into a ketogenic. There's another diet called modified Atkins diet for epilepsy. It's a little bit more liberal than ketogenic. Again, it's something that I would recommend most parents do with some nutritional support or you know, clinical support, but it can also be very helpful. It's a little bit more liberal than the ketogenic, but it also does reduce the ratio of fat to protein carb and has been shown to be quite helpful with seizure control. But in all cases, what you're thinking about is many of the same things we do with kids on the spectrum anyway, which is limit carbohydrates, promote more fat, more protein, and concentrate more on things like vegetables. So they're not inconsistent, but those are the things that I would look at very carefully for a child who's having seizures.
Great, thanks.
Okay, I'll grab one from here. It says well, I'm gonna actually answer two. There was a quick question that said, sorry, they're coming in so fast, I have to keep on top of them and find them. But somebody said something about soy. It was another question about soy. We are trying to eat more plant-based diet. What about tofu, tempeh, tofu skins from Asian deli? So I just want to refer back to the discussion I had before. When we're talking about soy, we're talking about that cross-reactivity with dairy, and we're also talking about the fact that it's potentially genetically modified. So for both of those reasons, I do not recommend soy as a big part of anybody's diet. So I would look at alternatives. If you're going plant-based, you really want to look more at nuts and legumes. other than soy, and think about those options, and then possibly add in the soy later. But then I had another question about my 7-year-old is mild, ADD mild, often had a stomach pain issue, often the stomach bulges. What kind of diet are you recommending? So again, the first thing you want to do is figure out what's going on with the gut, because this is clearly gut focused. So if the stomach is bulging, that usually means there's fermentation there. If there's fermentation, it means that there's some sort of undesirable bacteria, yeast, or other pathogen living in the gut that is feeding on carbohydrates. Carbohydrates are the source of nourishment for pathogens in the gut. They like to eat them. They eat them and then they ferment them and they make gases, and those gases make you have flatulence. They also make your stomach bulge. Your abdomen will distend. So when you see that kind of bulging after a meal, generally what you're assuming is that there's some sort of pathogenic growth, some pathogen, whether it's yeast, bacteria, other, and you want to help get rid of that. Again, you can do that with herbs. Probiotics can be very helpful and supportive in that. And then you also want to change the diet so you're not feeding the beast. You want to get rid of the complex processed carbs. And the thing that the good bacteria like are vegetables. So again, another reason why vegetables are super important is because it's going to feed the good bacteria. Now, the other thing that can be super helpful in regulating the gut and also in helping with mood is fermented foods. So even though I just said that fermentation in the gut can be problematic, when you consume foods that are kind of pre-fermented, they actually they grow good bacteria and they help colonize your gut with good bacteria. So eating fermented foods, things like kimchi, miso, lacto-fermented sauerkraut, pickles, kvass, kombucha, those are all naturally fermented foods. And those foods, you don't want to just go to the grocery store and buy sauerkraut off the shelf. That has not been fermented. They just basically stuck that in some vinegar. What you want is to look for the words naturally lacto-fermented. And when you get a naturally lacto-fermented food, it's actually going to be wonderful at helping grow those good gut bugs. So that's a wonderful way to help get rid of some of that bloating. But again, remember that bloating is telling you that the gut is dysfunctional. And that's where you need to put your effort, is trying to figure out how to heal that gut. And lots of vegetables and lower carbs is going to be a really good way to do that.
This is from Amina. She's in Glasgow in Scotland. She's asking about her son who's 6. Now, I know you just talked about another parent who's experiencing meltdowns with a young adult. This child is 6 and recently started having pretty serious meltdowns. And she was wondering, are the things that you said about the older young adult, would that rule be the same for a child this age? Would you look at things the same way, or is it slightly different with younger kids? And then she's also asking, and I know you can't give medical advice, but about the roles of magnesium and vitamin D, since in that area, they're like the northern U.S., they don't have a lot of sun. So she's wondering about that part of it as well.
Right. Okay. So yes, a lot of the same concepts and philosophies apply. You do want to think about, where are these rages coming from if they've just occurred? What changed? Is there an infection? Is there inflammation? Is there some sort of change in the gut function? What could be causing those rages if it's something new? And again, an infection can be a big part of it. Looking at things like strep, and I know this is not specifically related to nutrition, but looking for strep, looking for other infections that may elevate the inflammatory load on the body is important. And then giving those foods that are going to actually act as anti-inflammatory agents. And remember, it's not just food, it's herbs too. So something like curcumin can be really important for reducing inflammation, and reducing inflammation can help stabilize mood. So yes, you're looking at a lot of the same issues there. And yes, I can't give specific advice, but as we said, in northern climates, you're not making enough vitamin D. So supplementing and supporting vitamin D is super important. Now, the recommended ranges for vitamin D are very different than what you might see if you did a lab test. So at least in the U.S., when you order a blood test to check vitamin D, if it's above 30, that's considered acceptable. In integrative circles, we aim for something above 45 or 50, and somewhere between 45, 50 and 60 to 70. Those are kind of our sweet spots for where we want the vitamin D to be. If it's much higher than that, it can actually have paradoxical effects. If it's lower, it's just not enough for the functions, all the functions that vitamin D has to do. So really, that's your aim. And if he's not at that level, you would want to be trying to figure out how to support that vitamin D, whether it's with sun, supplement, etc. What we also see, though, is vitamin D gets wasted in the face of inflammation. So sometimes people are supplementing lots and lots of vitamin D and they're not seeing the numbers go up. That's another sign that there's some chronic inflammation happening, and this vitamin D is just being used so quickly. And as to your question about magnesium, yes, it's very calming. It does have that ability. There are many, many types of magnesium. We have glycinates and citrates and oxides and malates. They all have a bit of a different purpose. So if you're thinking about magnesium, it's important to know what type of magnesium you want for the purpose. Magnesium taurate, magnesium threonate are the ones that seem to have the best effect on mood and brain. Magnesium citrate is the one that seems to help the most with constipation. But again, let's not focus on one versus the other. You know, if you help the gut, you help the brain. So sometimes it's a combination of a variety of things that can help. But magnesium can be very helpful for calming. So that is something to look at. I have a question here that says, my son is on a paleo-type diet for 9 months, no sugar other than from fruits. He has good digestion. Just wondering what fruits are okay for him to eat and quantities. Also, is cold starches like rice and potatoes okay once in a while? So again, that for me would really depend on how he's doing. You know, when I have clients ask me those questions, it really is all based on, has he done really well on the paleo diet? Have you seen improvements? And if so, when you try to add a little bit of rice or potato, or if you try to add additional fruits, do you see any backsliding, or does he maintain his gains? I don't think any diet necessarily has to be for life, but you want to get your child into a place where they're stabilized and doing well before you start adding a lot of these things. And again, if you're adding a fruit, I wouldn't add rice or potato, you know, within the same few days. I would do one thing at a time, see how he tolerates it, and make sure it's in fairly small doses. So again, one serving, an increase of one serving, whether it be a fruit or rice or potato, would be where I would start. I wouldn't say, well, if he didn't respond to rice, you know, I gave him some, he was fine with it. I wouldn't then start giving him 3-4 servings a day. That's really going to change the milieu of his gut in a negative way. So again, part of it depends on how he's done, and part of it depends on how he responds to these foods when you give them. So it's a mixed bag. But I do think that if he's been paleo for 9 months, you want to start thinking about how and if you can expand that diet. Somebody wrote, I know that fruits and veggies are important. My son, who is diagnosed with ASD, is fortunately averse to sugar and junk food. Oh, lucky you. That's awesome. But a few months ago, he stopped eating fruits except banana and reduced veggies to asparagus, and now not even that. Any ideas on how to add veggies and fruit to the diet? I have tried offering different ones, giving them to baby sister. Initially, he imitated her. He now basically eats potatoes, bread, meat, fish, milk, and bananas. So when I see children focus very specifically on certain foods, I start to wonder if there's some sort of addictive part to that. Very often we do see that with bananas, when that's the only fruit a child will eat. Sometimes it's bananas and apples. Those are both phenolic foods. They also seem to cause a lot of, so look at him. When he eats those foods, does he get kind of a red cheek, red ears? Does he start giggling? Those are all signs that he is not responding well to bananas. But many kids will actually crave those foods that can be very problematic to them. So sometimes what you have to do is take out the banana before they'll eat anything else. And I know it's scary when you say, well, now he won't eat any fruits, but that is one of the ways to kind of expand the diet. In addition to which, sometimes when kids won't eat any of those foods, I try to look for other ways to get them in. So, for example, if they won't eat a carrot, will they eat a carrot chip? Will they eat it when it's crunchy and salty? If they won't eat berries, will they eat it as a berry sauce? Do they like that better? Will they do it in a drink? Would they do it if it was frozen? So I have a lot of kids who don't like certain textures or temperatures. And so if they won't eat the berry because they don't like the way it feels, but when it's frozen, they like to chew on it because it gives them more resistance. So it's very helpful to look at the variety of ways you can present the same food. I would also suggest you look at something called food chaining. And if you haven't heard of that, food chaining is kind of what it sounds like. It's basically starting with a preferred food, like his potato. And then if he's eating a French fry, then have him eat the French fry. He may like a specific brand. Then you give him one of the specific brand and another one of a different brand, just to show him that he can eat something different. Then you might go to a bite of a sweet potato fry. Then you might go to a chunk of sweet potato that's cooked. Then you might go to pureed sweet potato just to get a different texture in. But basically what you do is step by step by step, you try to get somebody to accept a different food that is similar to a food that they're already accepting. And food chaining is a long process, but it can be very helpful and very successful when you do it, in a slow, methodical way. The other thing I often remind parents is give the unpreferred food first when they're really hungry, especially if you follow it with something they like. I mentioned this before, kind of bite for bite. You can have the bite of your potato, or your meat, but you need to, take a bite of X first. So that can often help. So food chaining, bite to bite, finding different ways to offer the foods. And also there are protein powders, designs. I'm not supposed to use brands, sorry, but different very reputable companies make veggie powders, fruit powders, reds, greens, blue, purples, and they are just dehydrated fruits or vegetables. And you can use those to mix into something else just to get the fruit intake up. And again, think about things like all fruit popsicles or, sauces or, and different, use sliced lasagna as a noodle, sliced zucchini instead of a lasagna noodle. Try to get it in that way. So finding other ways to get the food in is important.
This one's about red ears. So the parent who sent this email.
I got one of those too.
Yeah. This parent said red ears equal bumpy mood. So they sort of know at their house that there's a connection there. So can you talk a little bit about what red ears might be telling people?
Yeah, so I mentioned that a little bit ago, but often when we see red ears, it makes me think of two things, either phenols or yeast. So if the child is eating and shortly after eating, it's the red cheeks, the red ears, the giggly, like you said, kind of irrational behavior, I am often looking at phenols. And then I would do a trial of getting rid of highly phenolic foods and seeing if you can get a more even mood from that. If the phenols isn't helping, and I would do this anyway, even in addition to phenols, but the other thing I would be looking at is yeast. And again, microbial, imbalances of good and undesirable pathogens in the gut and normalizing that gut function. So those are two big things. Sometimes it can be histamines, but that would be third on my list. Yeast and phenols are definitely higher in the hierarchy of what I would be looking at.
Okay, and related to that, this parent is asking, that same parent actually who had the red ears said that in association with red ears, her son will become very itchy and have a rash. It's not a raised rash, it's like a red rash on his body. Is that yeast or could that be something else? Obviously, you can't diagnose that by phone, but what might they be looking for?
Right, can't diagnose it by phone. Could be yeast, could still be phenol, or could be an allergic reaction. I mean, that sounds like it could be a frankly allergic reaction to a food. So that's something that you might want to test. And again, understanding the difference between an allergy and an intolerance. Allergies are the things, the IgE, the Ig stands for immunoglobulin, and we have different immunoglobulins in our body, IgE, IgM, IgA, etc., and IgG. So IgE is when you go to the allergist and he tests for an allergy, that's what he's looking for. That's the one that produces a histamine response. That's the one that you can get anaphylaxis from peanuts, or you have itchy, rashy hives or respiratory problems. So it may be that the child is actually allergic to something that they're eating. IgG tends to be more behavioral, and we see those also often delayed in onset. And those are that's a different type of food sensitivity, and there are no great tests for that. But sometimes if you're really between a rock and a hard place, we'll do some food sensitivity testing and try to figure out if there are specific foods that we want to remove. One thing I will say about food sensitivity testing, if you've gotten them, is if you get a food sensitivity test and there's a few very high numbers, like, oh, wow, a big response to apple and a big response to broccoli, for example, I would say, yes, that child probably has a food sensitivity to those specific foods. If you do a food sensitivity profile and what you get is 25 or 30 one-level responses, the lowest level, that to me speaks much more to overall dysbiosis, leaky gut, than it would to that specific food. You don't try to remove all of those foods because that's way too much to remove. And it's really telling you a different story. When you see that kind of diffuse, low-level sensitivities, it's really speaking about what's happening with the gut. We have experimented with various diets and see no real improvement. This is painful for the whole family. Is there any testing that will show whether my son has sensitivities so we don't do the diets unnecessarily? Unfortunately, there is no perfect test. I do think that with these different diets, I do use different types of diets for different kids depending on what their symptoms are. So it may be that without guidance, you're trying a variety of diets, and yet there might be one that would be more appropriate for your child than another one. So it may help to get some of that guidance about what his symptoms, behaviors, history are, and which diet might be the most appropriate for him. In the absence, it is very, very hard to do diet. I absolutely agree with you on that, and it's painful. When it works, it's great, and when it doesn't, it's very disheartening. There are kids who don't respond to diet, but may do much better with other interventions. So I don't know what else you're doing in terms of your interventions, but I would certainly suggest for you that you see somebody, get some sort of practitioner in your arsenal and have them help kind of navigate this for you. And when you do, if you choose to do a food sensitivity profile, bear in mind the things I said about, a few things versus a lot of responses. And also remember that I always tell people that a food sensitivity test is like a bad map in the forest. They're never 100% accurate. It's better than having no map at all if you're lost, but you're going to take a bunch of wrong turns. And that, unfortunately, is part of the process of doing food manipulation. And unfortunately, there's no way to get around it.
So this parent said, it's summer now, and my child who is on an STD diet is doing great. This is our second year, so we know that that's a good diet for our family. However, during the school year, inevitably, there are infractions. So her question is, when that happens, one, how long is the mood typically affected from that? Because she's indicating they definitely have mood issues. And then what can they do to try to ameliorate that? Or is there anything they can do?
Right. So it's great that you're doing it. It's great you see success. My question would be, what is the response when he has the infraction? Is it very noticeable? Is there a big change in behavior, function, cognition, etc., or does he seem to slide through it fairly easily? Because that would make a little bit of a difference for me in how to address it. But overall, I would absolutely give a digestive enzyme. I would absolutely give some sort of binder. So binders include things like activated activated charcoal and silica and zeolite. There's many different things you can use. But those are the two things that you're really going to want to do. In terms of other things, I mean, some people use things like N-acetylcysteine because it helps you detoxify, but N-acetylcysteine can sometimes exacerbate yeast problems. So if you're using SCD to control yeast, I wouldn't necessarily use that as my first choice. But there are some herbs that are great binders, things like, cilantro is a great detoxifier. Chlorella is a good detoxifier. Like I said, silica, zeolite, charcoal are great binders, and then the digestive enzyme.
This is a great one. It's from a young adult with autism, and he is asking this. He said during his teens, he went off of the diet. He'd done it when he was younger because he felt like it was pretty hard to figure out what was hormones and what was the diet. And so he did. But now that he's older, he's in college, he said he can see that he feels better when he's on a really healthy diet, just like anybody else. But he really wants evidence about why it works and if it matters or if this is what any person would experience. So do you know of any great studies or things that he could look at that might be helpful?
So there is data. I mean, if you go even to Google Scholar and just Google gluten casein-free diet for autism, you will get some studies there. Now, again, bear in mind the thing about studies, which is very frustrating for all of us, is that studies need to be funded and they're expensive. Most people don't fund studies on diet because they can't make money off the outcome. So when you don't see some of the studies that are as robust as we would like, it's often because nobody is paying money to fund those studies. But if you look, one of the great places to look up Jim Adams in Google Scholar. He has done a number of different studies he does many autism studies, but one of his studies looked at the role of a variety of things, but diet was one of them. It was a protocol where they took a certain amount of kids and they actually initiated a whole strategy for these kids, including things like omega-3s and digestive enzymes. And diet was part of that, and the outcomes were quite good. So that's one study that you could look at and learn a lot from Jim Adams. The other thing is, Denise, you know this, the Autism Research Institute posts a parent assessment tool where they rank the interventions they've done that were the most effective. And diet generally consistently comes up as one of the best interventions, one of the ones where they see the best outcomes. So that's another thing to take a look at. In terms of specific carbohydrate, there is one study, I'm forgetting it right now, but there was one study that had a positive outcome in terms of ASD. I can't remember who the author was. But so yes, there are studies out there. There are fewer and farther between than we like, but they exist.
Great. All right. I know you still have a lot of questions there, so I'll step back and let you tackle some of those.
Sure. I'm never going to be able to get to all of them, so certainly, Denise, I'm happy to do another one of these at another time. Somebody asked, can food sensitivities change over time? If my 8-year-old was tested with no sensitivity, same child at 28 is having meltdowns, 100% yes. Again, part of this has to do with his gut and how his gut may have changed tremendously over 20 years. And again, it may not all be food-based. There may be other infection/inflammation/mitochondrial reasons. There's so much, we know the mitochondria is also intimately linked in mood and fatigue and energy, and lack of energy causes a lot of mood issues. So those two things are very much connected. But yes, everything can change in 20 years, and so he certainly would benefit from another review. And that doesn't necessarily just include a food sensitivity profile, but kind of an overall review, especially if he's having this big change. One mom said, tips for a prenatal diet. I have a son with ASD who has leaky gut, so probably my microbiome is a mess. Can I use inulin? Somebody else here asked about the NEMCheck protocol, which also uses inulin. I can't tell you if you can use inulin because I don't know anything about you, and I would really need a comprehensive medical history before I could make a recommendation. We have heard wonderful things about NEMCheck. We have used it with a couple of clients. We have other clients who've used it on their own. To be honest with you, Personally, I have not seen the same outcomes as are reported on a lot of the parent forums, and so I don't want to say good or bad about it. My experience has been that in a couple of cases, the inulin made kids very, very hyper and ragey. And whether that was a die-off reaction and we just didn't push them long enough, I don't know, but we did try to push them for a fairly long time, and we really ultimately had to stop the inulin. Some people tolerate inulin well, others don't. In terms of prenatal diet, there is so much more to it. And again, I would recommend, I do prenatal counseling. I would certainly recommend you talk to somebody who does that and get a much more individualized and comprehensive recommendation, especially if you're considering having more kids. We have 4 minutes. I see this woman wrote, my child has a diagnosis of mastocytosis, so I'm doing a low-histamine diet, rotating histamine for him. Great. His behavior and mood seem impacted by different foods, not just histamines. Again, it's great that you're doing the low histamine, especially in terms of mastocytosis. I would actually be looking much more intently at other ways to reduce that histamine load. So whether he's doing any kind of enzyme or antihistamine, whether it's an herbal or other antihistamine to help keep that histamine level down. It also can be, people layer on. He could have a histamine issue and a glutamate issue, or he could have histamine and phenol. So it may be more than one thing. Very often, I don't know if anybody here is doing bone broth or fermented foods. Both of those I think are super, super important and healthy and supportive of gut and overall health. But both fermented foods and bone broth can have glutamine and or histamine in them, and both of those can be problematic for some people. So sometimes if we choose to do those foods because we've read great things about them, but so for example, for a child with a histamine intolerance, I wouldn't necessarily be doing fermented foods. So you want to think about that piece as well. Somebody wrote, what do you think about gut replacement? So what I think you're asking about there is fecal microbiota transplant. That's what I'm guessing that question is about. And again, Jim Adams is in the midst of doing a fecal microbiota transplant study, and he's having some interesting results which are yet to be published. We think that there's a tremendous amount of potential for it. As of yet, it's not being used in the autism population in any clinic where it's well regulated, so to speak. So we don't necessarily recommend people do it at home, but we do think it has a lot of potential for future.